a new age of medicine is dawning. When microscopic robots repair the human body from within. Imagine a time when microbots save the lives of the 500,000 Americans who'd otherwise be killed by cancer every year. When surgeons may one day be obsolete. All of this is possible if we can build these microbots. But can we? That's what I'm going to find out.
Inventor Dean Kamen is on a quest to find technology that will solve humanity's hardest problems. With correspondent Joanne Colin, they'll meet the mavericks whose radical ideas will change our world forever.
A million people a year die either on the operating table or in recovery. Frequently, the problem is trivial once you can get to it, but getting to it, the trauma of surgery, cutting somebody open, sewing them up, the pain, the risk, infection. The fix is easy, the trip to get there is so traumatic.
So let's find out if miniature robots or microbots can repair the human body without all of that trauma.
Great, take a trip?
Absolutely. While Dean is in Montreal, I'm in Zurich. It's here at the Federal Institute of Technology that an engineer named Brad Kratachvil is making some of the world's most sophisticated miniature robots, including a microbot the size of a flea that could one day keep you from going blind.
This is where we actually make the micro-robots.
How small is a microbot?
The micro-robots are between 1 micrometer and 1 millimeter in size. Just to give you a sense of scale, human hair on average is around 150 microns.
The diameter of human
Exactly.
hair? Oh, wow. Brad is building many different kinds of miniature robots, just trying to figure out how to propel and power them. But getting energy into these microbots isn't easy.
One of the major challenges of microrobotics in general is how to power these things. Storing power when you get very small becomes very difficult. If you think about animals, the smaller the animal gets, the more often it has to eat. An insect has to eat more frequently than a large animal like an elephant.
Because it can't store that energy.
Exactly.
No one's been able to make microbots that can power themselves inside the human body. So Brad and his colleagues in Zurich tried a different approach. They decided to power their microbots with magnets.
Magnetics was the only technology which could really deliver the amount of control and the amount of force generation that we needed. If you take a look down here, you can actually see the device moving.
Oh, wow.
This robot harvests magnetic energy and then generates the propulsive force.
It looks like it's kind of the shape of a spring.
Well, when we were looking at effective ways to make microrobots move, we looked to nature for inspiration. And what we found is that bacteria have a really nice shape for generating propulsive force. What happens?
Kind of a tail, right?
Exactly. So what we did is we built a system that could mimic that.
It looks like it's swimming, but of course that's you moving it.
Yes.
That is amazing.
So the way we can steer this is by changing the axis that the magnetic field rotates around.
This is so cool. Can I drive it?
Steer it left. More.
More?
Yes.
Uh-oh. Okay, you take over. It's disappearing off the screen.
So Joanne might not be a NASCAR superstar when it comes to driving microbots, but the ones she's found are pretty impressive. That said, the microbot she's about to meet puts them all to shame.
Making miniature robots move is no easy task. But these scientists in Zurich have figured out a way to do that using magnets. The next step is getting them to actually do something. So now I'm about to meet a microbot with a jaw-dropping mission to keep you from going blind.
So this is where we keep the Octomag. The idea is that current ophthalmic surgery procedures are fairly invasive. So what we're trying to do is build a device which can manipulate a micro-robot within the eye to then do some of the surgical tasks.
More than 4 million Americans are visually impaired. In some patients with severe vision disorders, there can be bleeding in the back of the eye, scar tissue can form on the retina, or the retina can even detach. If left unchecked, these conditions can cause you to lose your sight completely, but the operations to fix them are so difficult that only about 1,000 doctors in America are licensed to perform them.
The tricky part about these surgeries is that they require very, very high precision by the surgeons. So even slight tremor in the hand of the surgeon can mean the difference between vision and blindness in people.
These are delicate operations, and they only happen in conjunction with a highly invasive procedure called a vitrectomy.
A vitrectomy is where they remove the clear part of your eye, the vitreous. They have to have multiple ports into your eye, so multiple holes. And with this, then they will go in and use a tool to then kind of chop up the vitreous and then suck it out.
Wow, okay, that's not good. Octomag is designed to make this procedure a thing of the past. I'd love to see how it works.
So what you're seeing here is a model eye, and we have a small micro-robot injected into this. This robot is roughly the size of a flea. And this is a similar view to what ophthalmic surgeons see as they do the different procedures. The device would be introduced with a small injection, so you don't actually have to have stitches. The device would then be steered magnetically using the feedback looking through the camera, and then the device is removed in the same way it was introduced.
Would it one day replace the typical procedures altogether?
One of the major hopes and goals of working on microrobotic technology like this is that we can really help to change the way surgery is performed.
The fact that you can put this in the eye, move it around, and get it back out again, I think is really quite remarkable. I'm going to give it back to you because you could lose that really easily.
There's plenty more where that came from. 10 years ago, a lot of the microrobotics field didn't even exist. So we're just now getting much better at controlling devices at these scales. So who knows what's going to happen in the next 10 years.
I'm impressed with Brad's microbot, but it's got some issues. If you have a microbot that you're putting in somebody's eye, could you pull that little magnetic microbot around with a couple of magnets? Sure. If I handed you a little magnet and I handed you a piece of metal and you're trying to figure out, is that metal magnetic or not, you'd take the magnet closer. It's not a magnet, it's not a magnet, it's not a magnet, it's not a magnet. Bam! It's a magnet. You can make a very strong magnetic field over a very short distance. But once you start making the distances fairly large, it's very, very hard to maintain and control a strong magnetic field. If you take that microbot and you put it in an artery where blood is really being pushed at high pressure, at high velocity, it would be like the difference between paddling around in a placid pool of water and going over Niagara Falls. So far, we've seen miniature robots powered by magnets, including one that could end up performing the world's most sophisticated eye surgeries. But none of these microbots can operate inside the bloodstream. If they could, it would be a huge improvement in clinical medicine. I'm in Montreal, where they're building microbots that can move through your body and maybe one day cure it of cancer. They're created by grad student Evan Schechter and his visionary professor, Dr. Sylvain Martel.
Welcome, Montreal.
Good to be here. Tell me about this horrific place.
This is the largest engineering school in province of Quebec.
Fantastic. And what are you working on?
We're developing what we call microbots. Instead of sending drugs everywhere into the body, we can encapsulate the drug into those microbots and deliver the drug exactly where we want with minimum side effect for the patient.
And how far have you gotten?
Pretty far, yeah, pretty far. So let's
Fantastic.
show you
Let's go look.
Yeah, sure. Come meet me.
Sylvain's microbots are 30 times smaller than the ones we saw in Zurich. Their purpose? To deliver chemotherapy exactly where it needs to go. 500,000 Americans die every year from cancer, and that includes the ones that are being treated. Right now, when you take a pill or get an injection of chemotherapy, it goes everywhere. It's like you can go out on your lawn and say, it's terrible, I got a lot of weeds. Well, you could spray it with weed killer called gasoline. It'll kill the weeds. It'll kill your lawn, too.
In a lot of ways, it's toxic. It's poison to your body. So if we bring the chemotherapy right to the tumor cells, then what we can do is we can give a very high dose to the tumor while sparing the rest of the body.
It's a pretty exciting proposition. So what these guys want to do is make a microbot that travels through the body, arrives at a cancerous tumor, and destroys it without harming anything else. That's not so simple. The first problem is, how would the microbot find the tumor?
It gets a bit complicated because they need to be able to navigate in a maze of blood vessel. I mean, there's close to 100,000 kilometers of blood vessel. It doesn't matter how smart your microbot is, everything looks the same. So they need a GPS system.
The GPS system that Sylvain talks about is nothing short of ingenious because you can find it at your local hospital.
This is a MRI room. As you can see, it looks exactly like a typical MRI platform that we can find in most hospitals in the world.
Well, an MRI machine is a giant magnet that creates three-dimensional images for doctors to see inside your body. So these guys are saying, hey, why can't I use that piece of hardware to magnetically steer and drive and move a microbot? But there was one catch. Nobody believed it was possible.
All those people that told me that it's crazy ideas, it's science fiction, it's not going to work, it came so close that he could maybe be killed. And after 2 years, I was start getting a bit kind of depressed, right?
So for 2 years, people thought you were crazy.
Yeah, right.
That's a good sign, by the way. Right. It means it's a big idea that worked. Tests prove that the MRI could, in fact, be used to exert forces on his microbots and accurately guide them through the arteries. But then Sylvain hit another roadblock. Think of our circulatory system as a series of streets. Our arteries are like the wide avenues, while our capillaries are like the tiniest of side streets. Sylvain's microbots are too large to drive down those side streets.
It's too big to go in small blood vessels, and we're not going to get to the tumor. Then I start thinking about a backup plan. I said, what we need to have is a small sphere with a motor on them. And automatically, I talk about the bacteria.
Like Brad in Zurich, Sylvain saw that bacteria are perfectly designed for moving through these small blood vessels. Unlike Brad, he didn't want to build a microbot that mimicked bacteria. He wanted to get the real bacteria to go where he wanted them to go. But how? He found his answer online.
It's like 10, 11 o'clock on a Friday night. And then I go to my computer and, do search on the internet. I came across what they call magnetotoxic bacteria. I said, wow, bingo.
He has found bacteria that are attracted to a magnetic field.
These bacteria, inside them, they have a chain of magnets. Sort of looks like a string of beads. When they're in a magnetic field, this chain of magnets acts like a compass, and it turns the bacteria where they need to go.
So we're saying, here's a high magnetic field, and those bacteria are going to swim there under their own power because they like that high magnetic field. Is that sort of...
That's absolutely correct. We have a joystick attached to the computer that's controlling the magnetic field. So if you move the joystick, you can move the bacteria.
What I'm really now doing is I'm moving the carrot around, and just like in the cartoons, the mule that's always chasing the carrot, my carrot is really the magnetic field, and the mule here are all these millions and millions of little bacteria, and they're moving to follow wherever I put the point of the magnetic field.
That's exactly right.
You can see all of them gravitating. The whole flow is moving. That's very impressive. It's beautiful. Very obedient bacteria. The plan is to take the bacteria loaded with cancer-killing drugs and put them into polymer microcarriers. These carriers, guided by the MRI, will swim through the arteries until they can go no further. Once blocked, they release the bacteria, which are drawn by the magnetic field towards the tumor. There, they converge and die, releasing drugs that destroy that tumor. Based on your experience, to deliver a realistic way to use these nanobots and these bacteria to treat cancers, How long will it take before we can do that?
I hope that we'll be able to do this in a matter of years.
Years as opposed to decades.
As opposed to decades. Being able to help someone with a deadly disease is something that keeps you going. On those hard days when it's hard to realize why you're putting in long hours, it's something to think about. I certainly hope that this can change everything in the field of medical robotics and cancer treatment.
The whole point of his invention is to be able to steer the chemotherapy directly to a specific place, like a tumor. But if you have cancer everywhere, there's no point in steering your drugs to any one place. Now you're not looking for a few tumors, you're looking for a few hundred. But what if microbots didn't need directions from a doctor? What if they could find and kill tumors on their own? Coming up, they're not microbots, they're nanobots, almost 500 times smaller than the ones we've seen. They're turning the world of bioengineering upside down, and one day, they may save your life. So far, we've seen tiny robots capable of big things, performing eye surgeries and targeting individual tumors. But all these microbots require specific direction by the doctor. What if they didn't have that limitation? I'm heading to MIT, where bots are being built that can find their way to a tumor all on their own. It's a development that may revolutionize cancer treatment, and it's being pioneered by Sangeeta Bhatia and Jeff von Moltzen. What's wrong with how we treat cancer today?
Well, the drugs that we take to treat it go throughout your whole body and are systemically causing toxicity. So that's why your hair falls out, that's why you get incredibly sick, that's why it's challenging for people to even maintain their work life or care for their families.
What we have in our kind of arsenal is basically poison, and the poison goes everywhere, and that's why we get the side effects.
It's sort of like you know you have a fire in the wastebasket, but putting it out by flooding the building may not be a good idea.
It's a great analogy.
That's a good analogy.
So Jeff, to selectively deliver these poisons only to the cancer cells, are you using some kind of microbot to do that?
What we're using is smaller than a microbot.
These aren't microbots, they're nanobots, almost 500 times smaller than the ones we saw in Montreal, and a staggering 15,000 times smaller than the ones Joanne saw in Zurich.
So these are the two particles that we use. This is the first population of particles.
To give you a sense for how small they are, 100 of them, end on end, would be as thick as a sheet of paper. So they're really tiny.
So these first particles, they're made entirely of gold. They're able to absorb a special wavelength of light.
Here's how it works. A mouse with cancerous tumors gets injected with trillions of these first particles, which go throughout the body. 90% of them will miss their target, but a few percent will land on the tumor. At that point, a harmless laser is shined on the mouse.
So we actually use a laser that's specifically tuned to emit light that these particles will absorb and convert into heat. So the particles find the tumor, they act as antennas to take this laser light and convert that locally into heat. That heat then causes a local biological change.
It'll only heat up the particles that are in the tumor. It'll heat them up enough that it essentially makes a blister. And that's going to release certain kinds of biological information that, hey, I'm a blister. Now you send in a second set of nanobots, but this set of nanobots has the property that it goes after any cell that's telling you, I've got a sunburn here. And that nanobot goes to that sunburned cell. When that second nanobot gets there and sticks to it, it opens up, and that second nanobot releases the chemotherapy that says, you think you had a blister before, now you've got chemotherapy. And it kills those tumor cells. The concentration of chemotherapy at the tumor is 4,000 times higher than it would be if you just gave the person a dose of that same chemotherapy and it went through their whole body. If this success is duplicated in humans, it could mean the difference between life and death for thousands of people. And their next generation of nanobots will need no guidance from a laser.
Where I think this is going is when we scale up to a human as opposed to a mouse, what we'd really like to do is get rid of the light and have a system where the nanoparticles find the tumor all by themselves to achieve the same end result, but cutting out the light from it. So that's exactly the phase of research that this is in right now.
In the next 50 years, I do think that the way that we treat cancer will change completely. The convergence of engineering and biology is a new era for medicine that has already begun.
So these two could be at the forefront of a real medical revolution here.
Where do you think this stuff's going to take us? Where do you think we're heading with it?
There will clearly come a day when microbots are circulating in and throughout your body, doing jobs that right now we don't know how to do. Keeping your arteries clean, supplying nutrients, getting rid of toxins.
Isn't that somehow a little bit scary, though?
Well, all new technologies are a little scary to some people. I mean, I'm sure 5,000 years ago, fire freaked some people out. Nanotechnology is just the latest new chapter in the human effort to expand our capability. We call that progress. "18 Americans a day die while waiting for an organ transplant." But now, experiments outlandish enough to freak out even Dr. Frankenstein are offering hope to millions of people who desperately need it.
Truly astounding.
Body parts are being born outside the human body. New blood vessels are coming courtesy of a cotton candy machine. And a mouse in Pittsburgh has just grown a second liver that may signify the end of fatal liver disease. If you think this science sounds surreal, you're right, it is. But welcome to the world of regenerative medicine.
Inventor Dean Kamen is on a quest to find technology that will solve humanity's hardest problems. With correspondent Joanne Colin, they'll meet the mavericks whose radical ideas will change our world forever.
Joanne, regenerative medicine, whole new field where doctors are taking cells out of the patient's body, growing them up into tissues and sometimes entire new organs, and then giving them back to the patient.
Wow, what's the goal?
In this country alone, every 10 minutes, somebody's added to a list of people waiting for an organ donation. And many of those patients won't get an organ before it's too late.
It's sad that somebody has to die so that somebody else can live.
Exactly. But imagine if you could grow a kidney, a liver, a heart for every patient that needed one.
So exactly how does the human body regenerate itself?
Let's go find out.
While Dean heads to Pittsburgh, I'm in the heart of tobacco country, on my way to the Wake Forest Institute for Regenerative Medicine. It's here that a revolution in human health is underway. Body parts are alive, outside the body. If safely implanted, they could transform countless lives. The man behind their creation is like the Willy Wonka of regenerative medicine, Dr. Anthony Atala. So, Dr. Atala, is this the world's largest research laboratory for regenerative medicine?
Yes. We had over 1,100 people that worked in this laboratory. And really what we do here is work on creating tissues and organs. You're going to see many different types of tissues, from fingers to ears to heart tissue to livers and bladders.
Dr. Atala started out as a pediatric surgeon in the 1980s. Often, his patients were children born with birth defects that destroyed their organs. Atala did his best to help them, but often felt like his hands were tied.
Was doing surgery on babies. I mean, it was really nothing more devastating than being there in the operating room, doing a procedure that you know is not the best thing for that patient, that child, but you have no better options.
Take bladder replacement. Standard procedure calls for cutting out a section of the patient's bowel and molding this into a substitute bladder. It's a crude procedure, and no wonder, since it was first performed in the 1880s.
We were doing these procedures for over 100 years and thinking there has to be a better way. You know, why couldn't we just create a whole organ for them using their own cells?
So where did you go from there? Did you find any of your inspiration from reptiles that actually do regenerate?
Yes, absolutely. One of the things that we asked ourselves was, if a salamander can regrow its leg, why can't a human?
That's a great question. When salamanders lose a limb, they produce masses of cells akin to the ones that an embryo has, cells that can become different body parts. But humans have no such luck. So Dr. Atala wanted to see if he could trick our cells into behaving like the cells in salamanders. Medical experts wondered whether the good doctor had lost his mind.
The term regenerative medicine had not even been coined. Things like this were considered science fiction. So I had difficulty getting funding for this field. The skeptics would say, well, how do you know the cells will actually be able to grow?
At first, they didn't. Dr. Atala wanted to regenerate a bladder to help babies whose bladders were defective. To do this, he started out trying to make bladder cells multiply in his lab. Sounds logical, right? But nothing happened.
We were trying to grow these cells for almost 4 years with no success.
But it turned out the cells he really needed were right under his nose.
But in reality, what you really want are the cells which are under that little circle.
Okay.
These were bladder cells too. Today we call them progenitor cells. But back then, no one paid any attention to them because they were too few in number and appeared to have no useful properties. But then, Atala fed them a bladder cell diet of special proteins and nutrients. Bingo! They began to grow like weeds.
It was really a major breakthrough. We said to ourselves, wow, we now have a system where we can actually get these cells to grow. We can now go to the next step and try to start building these tissues.
Atala had figured out how to get these cells to regenerate. The next step was to get them into the proper shape. So this is actually what the bladder looks like?
That's right. So we create a mold in the shape of the organ you're trying to replace.
You somehow introduce cells to this scaffold and they go from there?
Right. The cells are actually in this liquid, and we then slowly place the liquid with the cells, the scaffold. You want to cover every single inch, very much like baking a layer cake. You do it one layer at a time. Then you place this scaffold in an oven-like device for approximately 2 weeks with the same conditions as the human body, 37 degrees centigrade, 95% oxygen.
With this process complete, Atala faced a moment of truth. For the first time in history, an organ created from regenerated cells was ready to be implanted inside a human body.
We definitely had a lot of trepidation. We asked ourselves a very important question. Are you willing to place this structure in your child? Your own child. And if we could look at ourselves in the mirror and say yes, then we would go ahead and proceed.
Atala performed the bladder replacement operation himself, and it was a resounding success. In the years since, 30 people have had this surgery. Because a patient's own cells are used in the regenerative process, none of the organs have been rejected.
This research will someday allow us to eliminate organ donation so that you can actually create your organ from the same patient and avoid rejection. Only 25 years ago, people thought that this was really science fiction, but we know, of course, that these technologies are indeed possible.
Joanne's in North Carolina with Dr. Anthony Atala, who stunned the scientific world by growing bladders in his lab and implanting them in people. It's all part of a scientific revolution called regenerative medicine. Now he's using this science to tackle the biggest organ in the human body, our skin. The process is called bioprinting.
The scanner itself.
Currently, victims of severe burns face a really rough future. If the skin on the burn area has been destroyed, their only option is a skin graft, a painful procedure where flesh is taken from one area of your body and sewn onto another. If this procedure isn't done quickly, the patient can die of infection. Bioprinting offers a groundbreaking solution.
What we do is we use a typical desktop inkjet printer, but instead of using ink, we actually use the patient's own cells. And instead of having pages come out, you have one layer of tissue come out each time.
I see.
The first thing that happens is that the area of the defect gets scanned, and then the computer actually generates an image of the defect. Then the cells are actually layered over the defect.
Once applied, the cells would form tissue and grow into the surrounding skin. If somebody had suffered a third-degree burn along their back, how long would it take for the skin cells to be printed and put back in place?
If you had to replace a deep burn in the whole area of your back, probably about an hour.
An hour? That's nothing. Surely you have to admit this is fairly mind-boggling stuff that you can rework the technology of an inkjet printer and use that for rebuilding skin on an actual human being?
You know, we try to use whatever technology we can.
Bioprinted skin will likely be in hospitals within the next 10 years. But for more complex structures, the wait is likely to be longer. That's because bringing life to body parts is one thing, keeping them alive is another.
One of the most challenging things that remain for us is really how to get blood and oxygen to these organs. And that's really what we're working on.
Your skin and the walls of your bladder are thin enough that blood vessels grow into them easily. But getting blood and oxygen into more sophisticated organs, like the liver, has been an insurmountable problem. Now a plastic surgeon in New York may have the solution, and guess what? It's delicious.
So far, we've seen body parts growing outside the human body in a laboratory. The first challenge was bringing them to life. By creating tissues from cells, doctors have been able to do just that. But right now, most of these parts just sit on the shelf. That's because regenerated body parts are useless until we can find a way to get blood and oxygen into them. Our body's system for doing that is extremely complex. And mimicking that has been beyond the power of even regenerative medicine's foremost physicians. Well, sometimes the big breakthrough isn't made by an expert, but by an outsider. And this may be one of those times.
I'm on my way to meet a plastic surgeon named Dr. Jason Spector.
Hi, I'm Joanne.
He's been working on ways to bring blood and oxygen into reconstructed body parts, but it hasn't been easy.
The body's circulatory system is incredibly complex. The density is in the millions per square centimeter. So you have to figure out how to recapitulate what nature has taken 4 billion years to figure out to get the exact density of blood vessels.
The question was how. Jason spent years studying the problem. Then one day he gave a speech upstate.
I was giving a lecture at Cornell University to a group of postdoc students, and the lecture was titled Tissue Engineering: A Surgeon's Perspective.
After the address, Jason was approached by a student named Leon Bellin, who specialized in nanofibers. The lecture got Leon thinking about the dimensions of human capillaries. He wondered, is there anything out there of a similar size that could replicate them? The first thing that came to Leon's mind was cotton candy.
I didn't know the fiber size of cotton candy, but one of the first things I looked up when I got home, and it turned out that cotton candy fibers really do range from about 10 microns to 100 microns, which is exactly what we needed.
That seems absurd, that cotton candy fibers are very similar in structure and size to capillaries. You decided to go and buy yourself a cotton candy machine? Precisely. Jason wanted to bring blood to new body parts, and Leon's observation inspired an insane-sounding plan for how to do that. Take a biodegradable material, pour it over cotton candy, and let it harden into a mold. Then dissolve the candy. This leaves imprints in the mold that look remarkably like our capillaries. Next, seed those imprints with cells and put the mold inside the body, where it dissolves. If all goes well, you now have capillaries that can bring blood and oxygen to body parts.
It's a completely biocompatible, biodegradable, scalable construct.
The next step is putting this mold inside the body and seeing if it can keep new body parts alive. The cotton candy itself has been junked in favor of more sophisticated materials, but animal trials are underway soon. If they succeed, it might mean we can finally bring regenerated organs to life. We've seen other labs, other people in the country who are building organs in the lab, literally. You apply your technologies to those technologies, what are we looking at?
Well, I think the potential impact is huge. This technique is a necessary step to make a transplantable organ. When this technology is taken to its fullest, I fully expect that there will be no reason to have to harvest organs from donors. It's limitless what can be done with it.
Jason's method is nothing short of mind-blowing, but he and his team are still relying on building the parts outside the body. I wonder, is there a simpler way? Maybe the future of regenerative medicine isn't growing organs in a lab at all. Maybe we can grow them right inside our own bodies. 18 Americans die every day while waiting for an organ transplant. We've been meeting doctors in the field of regenerative medicine who are trying to stop that from happening. In North Carolina, we found a physician growing cells to grow organs outside the body. Then we met a Manhattan surgeon whose discovery may show us how to keep those organs alive. Now I'm on my way to meet a doctor with a revolutionary idea. Let's say you're suffering from liver disease. What if you could just grow a new one? At the University of Pittsburgh, a doctor is taking the first step into a future where the human body's potential to regrow is fulfilled. He spent his life fighting for patients with liver disease. And his name is Eric Lagasse. So, Doc, in this country, I know that more than 100,000 people a year end up with end-stage liver disease.
Yeah, every year, 100,000 people will show up in a hospital and diagnosed with end-stage liver disease. We have 16,000 people waiting for liver transplant, and you have only 6,000 which will be transplanted.
10,000 patients hanging out there in critical condition. What's going to happen to them?
Well, if they're too sick, they will be removed from the waiting list, and eventually they will die. When patients have a totally broken liver, you have to regenerate liver cells and liver function, and that's a complex problem. I was not looking for incremental progress. I was looking for the big jump.
Eric isn't trying to grow an organ outside the body. His focus is getting a new liver to grow inside. I know that sounds insane, but your body is perfectly capable of accommodating a whole new organ. But how do you get a new organ to grow? Eric has spent the past decade trying to figure that out by taking mice suffering from liver failure and injecting them with healthy liver cells. But his experiments did nothing to stop the mousy massacre. So how many places did you try that it didn't work?
A lot.
I'm sure.
We tried to put them under the skin. The animal died. We tried the kidney. The animal died. In the spleen. The animal died. We spent many years trying different ways, and suddenly one day found out that there are one unique location in the body where you can actually regenerate the liver. That's what we call the Eureka Moment. Let's go in the lab and I'll show you. I will show you some of the liver cells that we have.
So Eric was taking these healthy liver cells and injecting them into the dying mice. For 10 years, nothing happened. Then, in what almost seems like a pathetic last-ditch effort, he just dumped the cells into the belly.
We tried another place where we thought it would never work, and it was basically the abdominal cavity. We basically transplanted the cells there, injected the cells there.
In the belly, around all the organs?
Yes, basically in the belly, simple injection of cells.
Weeks went by, and these mice kept living. And those mice didn't die, which means those cells somehow grew up to be able to supply the function of a real liver. That must have been shocking.
It was very, very, very surprising. And the next question was, what exactly happened? They must have done something to make liver function again. And the big question is, how? Did they migrate back into the liver and repair the liver? Or did they migrate somewhere else and did something sort of magical?
And the answer is?
The magic.
The liver cells had migrated to dozens of lymph nodes, tiny glands throughout your body. Normally, lymph nodes act as incubators, growing immune cells to fight infections. When Eric's liver cells showed up, 1 out of every 10 lymph nodes happily hosted them.
And what we did here, basically, bring now liver cells in this environment and basically show that, liver cells are also happy, like these immune cells, and they can produce a lot, and they can do something even more extraordinary. They can regenerate a liver.
The liver cells took over their lymph node hosts and turned them into little livers. Then, these organs started to grow.
The cells, as they grow into this mini liver, will grow and grow and grow until they reach the size of a liver. And then they stop growing and now make the work of what the liver was supposed to do.
Incredible. When you seize the opportunity to open up that animal and see that this had happened, I bet you didn't sleep that night.
No, yeah, I didn't sleep.
If I had made this incredible discovery, I wouldn't be sleeping at night either. So, Doc, I used to think the next really big, incredible opportunity is when you could grow a whole organ and then have it available for a surgeon to implant it. I think what you just said is, don't bother with that step. Why grow the organ outside and have to implant it? Let nature do the whole job the way it did the first time when you were born. Just take a few of these cells, put them in your body, and let your body manufacture the whole organ right where it belongs and eliminate the need for the surgeon.
We had a complete liver function recreated somewhere else in the body. So we have the roadmap here. Put the cell there, and at the end of the process, voila, you have the organ.
Think about it. Today, your doctor tells you you have end-stage liver disease. Essentially, your life is over. If all of what Eric is doing works, your doctor's going to tell you your liver stopped functioning. Come by my office in the morning. We're going to inject your belly with some new cells. They'll build themselves into a new liver. You'll be fine. That's astounding.
So when will Eric's technique be tried in people?
Joanne, you have to understand the huge leap required to go from laboratory mice to human beings. It's going to take years, and it's driving Eric crazy because he wants to be in people now.
I bet. I saw regenerated bladders that are saving lives already. You saw regenerated livers in mice. What do you think is coming next?
There's no limit to it. We're going to see organs growing in laboratories like kidneys, heart, growing every organ we need.
Do you think we'll even see the day where we reverse the aging process and live forever?
Well, now you may be getting a little greedy, but Joanne, never underestimate the power of science and technology. The human brain, it's an amazing machine. It's evolved over millions of years. But now, with some major help from cutting-edge computer technology, it's shifting into high gear.
What exactly are we looking at when we see the monkey?
Today, using just our thoughts, we are moving boulders with our minds, beating back paralysis, and one day even controlling an artificial arm. The future's wide open as scientists tap into the power of the mind.
Inventor Dean Kamen is on a quest to find technology that will solve humanity's hardest problems. With correspondent Joanne Colin, they'll meet the mavericks whose radical ideas will change our world forever.
Joanne, believe it or not, 1 out of every 50 Americans is dealing with some kind of paralysis. We've got to do something to restore capability for these people.
How do you do that, though?
One of the really exciting options out there today is what's called BCI, Brain-Computer Interface. Imagine being able to do nothing but think and have some real physical object respond. Imagine if we could restore mobility to the disabled community and allow everybody to move objects just with the power of thought.
I think I'm going to have to see that to believe it.
I'm ready. Let's go.
I'm in San Francisco to meet the brains behind a promising new technology. Visionary Tan Lee has spent most of the last decade perfecting a revolutionary headset that's breaking down the wall between man and machine. Amazingly, the technology lets you control a computer with just your thoughts, opening the door to a day when this headset, or others like it, could change the way you live your life. From how you control the thermostat or lights in your house, to dialing a phone just by thinking about it. And those simple tasks are just the beginning. So Tan, what are we looking at on the screen?
What we're seeing here is an EEG feed of my brainwaves in real time.
Although she's just 32 years old, Tan's already a successful entrepreneur, thanks to a technology company she co-founded in Australia. Is that what you always wanted to do? You wanted to kind of
be able to control things in my mind?
Unleash the power of the human mind?
When I was a little girl, I dreamt of the ability to control and move objects just by thought, right? But that's just a childhood fantasy.
Today, she's made her childhood fantasy a reality. Traditionally, scientists have used EEGs, which stands for electroencephalography, to measure the brain's electrical signals. They use it to study comas, seizures, even what's happening in your brain when you meditate. But Tan has discovered an amazing new use for it as the first of its kind commercially available brain-computer interface device.
So what that means is you're using your brain for controlling computing applications. And the process involves collection of brainwaves, measuring them accurately, processing them in some way, and then using those to drive an application.
The potential for a headset like this is limitless. So in a way, we're sort of talking about telepathy.
It feels like that when it's done right.
Tan's goal? To use the brain's electrical signals to control a computer in a reliable way.
Everything that we read said that it wasn't possible. We interviewed a bunch of EEG experts and they all said, you know, what you guys want to do has been tried before and it's been proven to fail. So we thought, well, that's great. It doesn't seem very likely at all that we're going to succeed.
Up for the challenge, Tan and her partners developed a software program that broke down the brain waves into thousands of parts. But to really work, it would have to filter out a ton of background noise. Imagine lowering a microphone into a packed stadium and trying to pick out just one or two of the conversations going on in the stands. That's akin to the monumental challenge the design team was facing.
You can't stick a metal probe and isolate that precise area where you're interested in the signal. So the fundamental challenge is the folding of the cortex.
The folded cortex Tan is talking about are those ridges and grooves in the brain's surface. Because of these folds, the electrical signals passing back and forth become much harder to read through the skull.
We were able to create software that essentially unfolds the cortex so that we can map the signal far closer to its source. Up until that point, we'd worked for about 18 months to try and see whether this was even a feasible idea or not. So it wasn't like an overnight thing. There was so much trial and error. I mean, I still get chills thinking about that moment because it was just so surreal.
Tan Lee and her partners designed the headset to be a cutting-edge research tool. But they've also tapped into a massive and surprising audience. Gamers. I couldn't wait to take the headset for a test drive myself. Okay, so what are we looking at here?
So what you're seeing here is a simple avatar, which is a representation of what's going on in your face.
The signals picked up by the headset are separated into 30 mental states, based on emotions, facial expressions, and actions.
And this is all about being able to move the object with your mind. So you see this virtual orange cube here.
Yes.
What we're going to try and do is allow you to manipulate it using your thoughts.
As she describes the process to me, it all sounds kind of out there. Could I really control an image on a computer screen just by thinking about it? To begin, Tan asks me to focus on lifting the cube. The computer stores the EEG pattern, recognizing it again when I repeat those same thoughts.
Okay, so now that you've thought lift, we accept that. The cube then is live, and you can try.
Okay.
Sure. And you want to actually think about lift and hold that thought. Good stuff. She's good. Good mind powers.
And back down. That cube is getting heavy.
Yeah. So shall we try disappear?
Sure. Tan's right. Manipulating the cube is an amazing out-of-body experience without a keyboard, without wires, just by focusing my thoughts.
It's quite the Jedi.
I feel like I've stepped into a science fiction movie. But in fact, the device isn't really reading my mind, it's picking up the electrical patterns that my brain makes when I concentrate on lift or disappear.
Right now, the headset has found an audience among gamers. But Tan is also partnering with computer developers to develop other uses for the headset. In the next few years, this technology could revolutionize everything from how we communicate to how we move through the world. This remarkable game could be a game changer. Earlier, we've seen how a mind-blowing headset can control images on a computer screen by interpreting your brainwaves. This technology is still in its early stages, but brain-computer interface has the potential to be a real game changer. While Joanne is in San Francisco, I'm in Atlanta, where the next generation of brain-controlled computers is in the works. This technology may one day help millions of people who suffer from paralysis, including locked-in syndrome, a disability which is portrayed in the Oscar-nominated movie The Diving Bell and the Butterfly.
Locked-in syndrome is probably one of the most devastating things that can happen to a human being. What it means is that the person is completely paralyzed and unable to speak. And one of the things that we're trying to do in the Brain Lab is give these folks options for quality of life by controlling computers and other devices with only their brain signals.
Melody Moore Jackson is the big thinker behind Georgia Tech's Brain Lab, inventing brain control devices for people with severe disabilities. She's the head designer of the Aware Chair, a revolutionary wheelchair that's controlled by a person's brainwaves. The chair's design, which Melody has been working on for almost a decade, took a major leap forward when she teamed up with Michael Boyce, a grad student at Georgia Tech. Michael has cerebral palsy. He's used a wheelchair since he was 7. In the lab, he's taken an ordinary wheelchair and turned it into a brain-controlled prototype. And you had been thinking about this and been working on this even before you came to this lab.
I try to stay up to speed on, all the latest technology with wheelchairs, like your work.
Michael's talking about a wheelchair my engineers and I invented called the iBot, which uses sensitive gyroscopes to balance itself. The iBot gives people amazing freedom, but it hasn't incorporated what Michael has developed, a brain-computer interface to control it.
I really just wanted to find a way to use this unique disposition that I have. It's really a gift. I'm a technologist with a disability.
That disability has been with him since childhood, but it hasn't defined him. I'm impressed with how nothing stops Michael. He's found ways to work with whatever's right in front of him, in this case, his own wheelchair.
There's a lot of research out there on smart wheelchairs, but oftentimes the research teams failed to really talk to actual people who use wheelchairs.
And so you decided to hack into your existing chair and replace the joystick with a system that would allow you to more naturally control the movement of your chair.
Correct. If you think about driving a wheelchair, I didn't want it to just be go forward, go forward, go forward, go forward, because what you're doing is you're inducing cognitive strain. I've been disabled my whole life, and the last thing I want to do is give someone like me more stuff to worry about.
I, like you, would of course go crazy if you had to keep repeating something that you didn't want to change. Keep moving, keep moving, keep moving. It's easier to say to somebody, keep moving, and when I want you to stop, I'll tell you. That's what Michael incorporated in his control strategy. To control the chair, all Michael has to do is look at one of 4 patterns on his computer screen, each flashing at a different rate. For a paralyzed person, they're like a virtual steering wheel that tell the chair which way to go. Each of these grids triggers a unique response in the brain, strobing at a unique rate.
Depending on which one of the flashes that I pay attention to, the wheelchair figures out, this is the frequency I'm looking at, this is the appropriate movement that I need to make, and it causes the wheelchair to move accordingly. I can increase functionality, I can minimize cognitive drain, and most importantly, and I would really stress this, is increase the quality of life for people with disabilities.
And that's exactly what this chair could mean for millions of people. The Brain Lab team plans to make the software available in the next year for anyone who wants to use it, for free. The technology we've seen at the Brain Lab gives an amazing amount of control back to people who are locked into their bodies. But what if we could take BCI to the next level and directly use the brain to control a complete artificial limb? We've seen how researchers can tap into the brain's electrical signals at the skull surface to communicate with computers. But what if we could go even further and put a sensor directly into the brain itself?
I'm going to the University of Pittsburgh to meet scientist Andy Schwartz, whose groundbreaking work with monkeys may one day even cure paralysis.
We're really focused on trying to restore people to have normal lives again. And we're trying to do this by restoring movement to people who are paralyzed, and not just movement, but natural movement.
For over 3 decades, Andy has studied how the brain controls movement, carefully mapping what's going on at the cellular level. But his desire is to push this research even further, to use this knowledge to independently control a robotic arm with nothing but your thoughts. His dream is now becoming a reality. Meet Gustav, a 2-year-old rhesus monkey. It's hard to believe, but he's successfully operating this computerized robotic arm just by thinking about moving it. Critical to the research are the 2 microelectrode arrays implanted in his brain.
Well, what we do is we actually implant little microelectrodes into the brain itself. And they don't penetrate very far into the brain, only about 1.5 millimeters, which is shorter than a thumbtack. And so it sort of looks like a miniature pincushion going into the brain.
The electrodes are carefully placed on the motor cortex, the region of the brain linked to voluntary movement.
This is the array that we put in. These are microelectrodes, and there's a total of 100. It's 10 by 10.
There's 100 right on there?
100 little tiny electrodes. At the end of every little pin, there's a little recording site, and it's microscopic, 10 microns in diameter, and that's about the right size for recording from individual neurons.
There are billions of neurons in the brain, each one with thousands of connections that allow them to communicate with each other. The monumental challenge? How can microelectrodes this small pick up so much complicated information passing between these cells?
Think of the brain as a continuous stream of information, and these electrodes are little cups going in and sampling it along the way. They provide a unique snapshot of how these cells are communicating with each other at any given time.
The monkeys were able to move their arms to different targets initially, and then what we did is we trained the monkeys to actually draw. So we put them in a virtual reality environment, and we trained them to draw different shapes.
By studying Gustav's brain activity when he moves his arms, Andy and the team are able to map how the neurons speak to each other, creating a remarkable blueprint of how the brain transforms thought into action.
So the neurons are talking to each other by firing these little pulses of electricity. It has this characteristic shape, and we can distinguish this shape, for instance, from another shape. So here's another one recorded on the same electrode.
These colored lines on the screen represent neurons firing. Andy designed a cutting-edge computer program that can recognize these electric patterns in the brain.
And we found that we could capture everything. And so we're trying to understand how these signals shoot around the brain, how they come together to finally contract muscles in a pattern that we recognize as movement.
In the lab, the team monitors the room next door, where the heart of their research is underway. Working with monkeys instead of lab rats, for example, makes a lot of sense. Their arms resemble ours, and they can be trained to do these tasks. Every time Gustav grabs onto the moving target, he's given a liquid reward. Andy, what exactly are we looking at when we see the monkey in that monitor there? What's the monkey doing?
He's watching this robot arm that's mounted next to him. He has one hand that's free to move, but he's just resting in an armrest, and he uses that to push a button to start the trial.
Okay. All he knows is that he thinks and the robot arm moves.
That's right. We just demonstrate the arm moving for the animal, and then it's almost as if he's imagining that it's his own arm.
You know, I find it quite remarkable that the monkey learned to do this by observing the robotic arm, not by moving his own arm. That's what you're saying?
That's correct.
The monkey, in a way, is retraining his brain, adapting his thoughts to control the artificial arm, while Andy's team is adjusting the computer program, making the arm easier to operate. It's just incredible. Monkey and machine are evolving together.
And that's actually necessary because if we want to use this in a paralyzed person, we can't have the paralyzed person practice this with his or her own arm. We have to actually use the same procedure.
Andy's ultimate goal, to use the same technology to help paralyzed individuals, is about to be put to the test. We have seen major advances in BCI technology that show huge promise for people with paralysis, but so much of the BCI technology is hardware heavy. For this to truly work in people, these components are going to have to shrink way down, but that process is underway.
So how do you take the work that's being done here in the lab to humans who would benefit from these prosthetics?
In order to really make this practical for humans, we have to take all this equipment and miniaturize it so that it's basically a chip that can fit in the body. So right now, the monkey has a plug on its head, and the initial humans that we have will have plugs on their heads. But we don't want to continue that. We want to remove this interface so that there's nothing coming through the skin.
Okay.
We actually have everything we need to work with humans right now.
Andy plans on starting clinical trials with people in 2011.
We're going to be using spinal cord injured patients, so the actual arm will probably be mounted on the wheelchair so that the subjects will be able to pick up objects, perhaps feed themselves, operate different types of machines with the arm. Any little bit of self-sufficiency that you can give these people, I think, will go a long way.
Andy Schwartz is doing some really cutting-edge work here, and that's fascinated our team since we started working on our prosthetic arm, which we call the Luke arm. Right now, clinical trials are underway to test the arm. It's currently controlled with a motion sensor device, but my ultimate goal is to make it fully integrated with the human body. To do this, I'm partnering with a team at Brown University. Here is how the brain-computer interface would work. A chip would be implanted into an amputee's head. Its signals would run through a computer interface and back to the arm. It offers a tremendous amount of hope to stroke victims, paralyzed individuals, and amputees, giving them all the freedom that they deserve. Joanne, it's incredible how far we've already come with BCI, and this is just the beginning. We are starting to learn more and more about the ultimate computer on this planet, the human brain. There's no telling where this is going to go.
And as we do learn more?
I think the world will radically change in ways that most people can't even dream about right now. It's going to be, I think, the biggest revolution of our time. It'll change the way we work, the way we play, the way we interact with our environment, and it's all going to happen way sooner than